Hello everyone and welcome to our chat today. Today I'm joined by Tom Wainwright and Shay Bahadori. I've known the guys for a few years now. We had the pleasure of spending a week in Baltimore together, and today they are going to talk us through the work that brought us together and the research project. So Tom, I'll hand over to you and tell us a bit more about what you do at Ori.
Thanks, Andy, and thanks for inviting Shay and I to join you. A bit of background: I'm a physiotherapist by profession and associate professor in orthopaedics here at Bournemouth University. Shay is a biomedical engineer. He's been working with us for the last 5 years, and he really heads up all of our labs and is involved very much in the day-to-day of running all our lab equipment. So. My aim is to give the overview and some of the clinical parameters, and then Shay's going to talk more about the technical details. That's where his expertise is much greater than mine. So probably best to go back to the start, really. When we met you 4 or 5 years ago, Andy, you got that dream call from me saying, I want to buy a Primus. Not knowing me from Adam, I think it was the easiest sale you've ever made. But I contacted you about that because we were just setting up Ori at that stage. Myself and Professor Middleton, who is a hip surgeon working down here in Bournemouth. And we've been involved in clinical research in orthopaedics for over 10 years working together. And we really wanted to expand our work and create facilities that could further the research that we were doing. And that research really is about how do we optimize the care of patients undergoing orthopedic surgery, specifically hip and knee replacement. So we set up the Orthopedic Research Institute, and we were very fortunate to receive a grant from the Dorset Local Enterprise Partnership. And this grant allowed us to create the equipment and facilities that we wanted so that we could create a world-class lab and facility so that we could look at patient recovery after joint replacement. Now that development included state-of-the-art muscle testing equipment such as the Primus, but also the setup of a gait laboratory and a whole range of other testing equipment. So the research that we are interested in is really about how do we improve and further optimize functional recovery after joint replacement. So hip and knee replacement are very successful operations. Patients report a great satisfaction after them, and in the most of cases get a great reduction in pain. They also, on patient-reported outcome measures, report that they are improved in their functional activities and activities of daily living. But if you delve into the data and look at the quantitative studies where you look at activity tracking or parameters of gait or muscle strength, actually at the 3, 6 month and 12 month, you can find that patients don't do as well as we think they perhaps might do or could do. Now, as a physiotherapist, this leads us to say, okay, well, what more could we do intervention-wise, and what more therapy or rehab could the average patient get that could improve their outcome? Now, this is going to be more significant as time goes on. We've got a changing demographic. We've got more people with arthritis. More people are going to need surgery. But also, you and I are going to be working well into our 70s, probably, depending on your pension arrangements, Andy. But I'll definitely be here until I'm 70. So there's a strong probability that myself and colleagues of the similar age, we're going to be needed to continue work and continue our social activities after having had joint replacement. So frankly, our needs and our functional needs are going to be higher. So it's now that we need to research better ways to rehab patients and get patients back to those levels. So the first thing that we need to do, and it's not available in literature at present, is to truly characterize recovery trajectories post-surgery. And what we need to do is we need to understand at what points patients recover muscle strength and in which muscles, and also in terms of gait and other functional activities. And these need to be measured objectively. Early research is showing that objective measurements are more accurate than patient-reported outcome measures in terms of early functional recovery. And so this is where we need labs and facilities like ours to do this research. Now, we're doing that research, and I'll talk about that a bit later on after Shay's spoken. We're doing studies with colleagues locally here, but also in other parts of the country to map that recovery trajectory of patients. But before you do that, you need to refine the experimental sort of procedures and protocols of how you're going to measure those things. And that's a publication that Shay and I put together recently and have published. And that's the one I'm going to invite Shay to talk through now. And that protocol really described how we were going to measure both muscle strength and gait analysis as part of these future clinical studies. Over to you, Shay.
Thank you, Tom. I actually have a few slides which I'd like to share with you guys. I'm just going to switch screen. Can you see my screen now?
Yeah.
Yep.
Great. So I'm just going to go from beginning. So yeah, as Tom kindly introduced, my name is Shay Balduri, and I've been working with Ori for about 4 or 5 years now, and most of my work is around the lab equipment and how we look after them and how we utilize them the best. I just wanted to, in terms of the muscle testing, just provide a quick outbrief of why we think Primus is great in contrast to the other handheld dynamometers. Obviously, we have both of those options. We have a Primus, we have a handheld dynamometer, and there is lots of options that you can contrast. You know, have a look at which one is the best for your clinic. But the reason we wanted to use Primus was mainly because of the features and options that it gives us when it comes to collecting data. And we really are looking at quite unique kind of testing of this muscle strength, and we are looking at before and after surgery. So we wanted a protocol which is very good, but also provides us a very good outcome in terms of accuracy and validity. And that's where Primus could really help us, because you can repeat that protocol quite easily. So in terms of some of the features, the best one and the one that we think is best suited for our institute was the isometric testing. Obviously, Primus allows you to do isotonic, isokinetic, range of motion. It can be used for treatment. It can be used for a variety of other tests in terms of lifting, pushing. But we wanted to keep it simple, but have a very good and accurate reading. And that's where Primus came into it. So Tom mentioned about us having the funding and trying to find the best option, and that's where we selected Primus. But in terms of the protocol itself, we looked at quite a few outlines of what we can collect with specific patients and individual, which then later on we can utilize with total hip replacement patients too. So the muscle strength test that we tried to analyze was the hamstrings and quadriceps. So this is knee flexion and knee extension. And we created a protocol in which it was quite robust. It can be repeated easily, but there were critical points to it. So we found, for example, alignment of the system to the knee joints, things like verbal encouragement, as well as ensuring the patients are not pushing back, give you a lot of good data and a lot of robust data, which then later on you can take forward and use for patients. In terms of going forward with this study, we created a small video, which I think it gives you an outline of what the protocol was like. And if you don't mind, I'm just going to play up. It's a very short video, but it also takes you quite step by step how you can best utilize Primus to collect your muscle, lower limb muscle testing. So here's the video. It has a sound as well. So I'm going to.
Can't hear any sound, Shay, but I think it may be worth just talking over. I don't know if you guys can, but what's interesting about this journal, and then it really lends itself to this kind of thing, is that it's the Journal of Visualized Experiments. So all articles are published with a peer-reviewed video as well, so that anyone can not just read your experimental protocol, but there is a full, I think, 10-minute video that allows anyone to replicate exactly what you've done. And I think, again, when we think about transparency of not just reporting of outcomes, but reporting of methods, I think that's really important. So although we haven't got the commentary, or it's not coming through on mine anyway, we can provide the link, and anyone can go and have a look at this online and see what we did.
Yeah, absolutely. And the main point was that with this general visual experiment, as Tom mentioned, we could easily replicate this, and anyone can do it as well, utilizing Primus system. And we, as I mentioned, we used it quite simple as well. We only did knee flexion extension, and the literature is a lot of research is around those two parameters being a very good indicator of patient recovery after operation. So as Tom mentioned, we will provide the link. The sound, it goes through it, and he specifically talks about the steps and what should be utilized in order to make sure the data is valid and reliable. So just to kind of now going forward, we collected the data, and we currently have a healthy normal data, which we are going to use for future research as well. And we found, the left side and right side flexion extension, and we have also found a quite unique and quite nice insight into perhaps the ratio between these hamstring to quads, which may not been looked at quite a lot in terms of the hip replacement patients. But overall, we think the Primus is a great tool because it gives you a great option in terms of all range of muscle testing. But also, the data that we collected is in line with other literature. So all the books, other systems that used have also got similar kind of data to what we had, which shows it is very reliable tool, and we can truly use it for producing a high quality research data and research outcome. So most of my talk was about why we use Primus and the technical aspects of it. But we're taking all of those knowledge and all of those information to our future studies with patients with hip replacement. And we think the data that we're going to collect may be a very good indicator onto patient recovery. And Tom will talk more about what we're doing with the Mako hip replacement. But at the end, if there is any technical kind of question, Andy, please let me know, or I'll be happy to answer them.
Thank you. That was really good.
Thanks, Shay.
So I'm just going to sharing. There we go.
So I think.
Yeah, go on. If you want to finish off, Tom, from your side, I've got a couple of questions afterwards, but yeah, please.
I was just going to say, I mean, we've given an example there of quite a simplistic use of knee flexion extension. Obviously, one of the reasons when we're setting up the Orthopaedic Research Institute was that we needed flexibility for future subjects. So that's just one way of using the Primus. You can test it, use it for testing pretty much in every direction for every joint in the body, and in a whole manner of very specific movement tests like we've done there, or using the cable system, different functional movements as well. That's something that we explored with these patients, but we're looking within our outcome study for hip replacement at time points at pre-op, 6 weeks, 3 months, 6 months, and a year in terms of the hip replacement patients. Now, the issue we had pre-operatively, these patients are in quite significant pain. So getting them to do a whole whole remit of tests around hip abduction and, hip extension and controlling for those movements. Bearing in mind, we're also doing gait analysis with them. We're also doing a whole range of other tests with them. It was just too much for them to handle. So that's why we've pared it down to those two simple tests. The other thing to say is that we're not saying that handheld dynamometry is not a good way in the field and in the clinic of finding an objective way of testing muscle strength. It absolutely does have its place. But when you're looking at lab-based research, we're very fortunate to have created a clinic environment here at the university. We've got clinic rooms in that clinic. Then I think you should strive for the gold standard in terms of accuracy and reliability. And that's why, as Shay outlined, we use the Primus. So the particular research that Shay sort of indicated there was some research that we're doing looking at the functional outcomes of patients after robotic assisted hip replacement surgery. So robotic surgery across all surgical specialties has increased over the last 5 to 10 years, but in orthopedics over the last 3 to 4 years, it's really started to take off. Firstly around the knee, but now more latterly around the hip and spine and other areas. And there is a cost associated, with using robotics. So therefore, it's really important to analyse whether the outcomes really are, from a clinical and scientific perspective, better. And that's where the work that we're doing will hopefully play a role in the future. So it's exciting work, and not just the data set won't just tell us about the fact that it's robotic hip. It will be, from our knowledge, one of the most comprehensive data sets of post-operative outcomes that we're aware of in the literature. So we're really excited about it, and definitely having the facility here, and thanks to the university for supporting us, and also our local enterprise partnership in Dorset for allowing us the grant to be able to get this equipment in. And I'm just really pleased that by creating that facility, we've then been able to go and get externally funded grants to then sort of offset that investment and pay back, really. So yeah, it's really exciting and something that we're really pleased to be part of.
Great. No, it's really interesting. Thank you very much for putting that together. In terms of the actual impact that you talked about in terms of showing the success or the comparison between robotic and non-robotic, is that the impact that you want this to have, is to kind of say, yeah, this is a better way of doing things?
Well, the research around the robotic hip, that there'll be a lot around the surgical outcomes as well. The key thing at the moment, before we can look at specific interventions and whether they outperform functional recovery, is to accurately map what functional recovery looks like. And to do that, we need to understand the recovery trajectories of patients, but we also need to be able to characterize which patients will recover in different ways. It's not, it's very obvious to say that actually how one patient, we can all think of a patient that's covered really well from joint replacement surgery. We probably all think of one that's not so well, but what characterizes the ones that do really well versus the ones that don't do so well? Because likelihood in the future that we need to be nuanced, because we don't have endless funding within the National Health Service. So for example, if you had a hip replacement, if you say, well, I want a really experienced senior physiotherapist to see that patient twice a week for 12 weeks, they're probably going to do pretty well. But of course, we haven't got that resource, and that's not going to be feasible. So we need to know which patients need potentially less hands-on or less face-to-face impact. That may be versus self-directed or tele rehab. It may be which ones need to come into a class, and what kind of exercises and what type of dosage and intervention do they need. And it may be which specific groups do we need extra interventions. You may argue that if patients are going to improve muscle strength, for one example, and they're in a certain demographic, should we be looking at nutritional supplementation in addition to their exercise? There's lots of research questions that we could ask, but those are only valid to ask when we've accurately understood the current trajectory and characterized for which patients it's going to work, current recovery is working well, and for which patients it's not. And that, believe it or not, that's not clearly defined in the literature, especially from an objective level. Most of the research is around patient-reported outcome measure, and this is where instruments and equipment such as Primus are important.
Yeah, I think that's really interesting. And again, I was speaking with another Primus user in the NHS who are using the system for long COVID, and again, being able to stratify risks in terms of who needs more rehabilitation or less. So do you see this being, you may not have the answers yet, but do you see it being that someone would need to have some sort of assessment before then deciding whether it's a group class, home-based, or more intensive rehab in the hospital?
I think we're away from that, and I think if you look more broadly at the research, I think sort of demographic, social, and those kind of things, social status have very big sort of effects on how how you recover post surgery. There's also things that we need to better understand around comorbidities and those with multiple comorbidities, and also those of sort of increased age versus younger patients. But what's interesting there is we always think, oh, the elderly patient, the older patients need more input, but actually we're doing research to better understand the needs of younger patients. There's an increasing number of younger patients that have hip or knee replacement surgery. And actually those are the ones where strength is more important because they've got more active demands. I can think of a patient that we've worked with recently in his 40s, who's a personal trainer, wanting to get back to training, wanting to get back to surfing and an active lifestyle. So it's for someone like him that this kind of measurement potentially in the future would be really important, so that he could track progress, he could look at right versus left, operated versus non-operated comparisons, and very much more apply the more performance-based model that you would see in professional sport, whereby this kind of routine screening and baselining of patient strength at the start of an injury and recovery and through their recovery process is common practice. So yes, that could be in the future, but it probably won't be for all patients, if that makes sense, because for some patients, other factors will be more important in terms of their rehabilitation. Rehabilitation is not just about strength; it's about a whole, sort of 360 sort of degrees of different factors.
No, great. No, I really appreciate that. Well, I think we'd love to have you back on when you're further down the line in terms of analysing the data, but I really appreciate you sharing your experiences to date. Anything else that you think is worth adding at this stage?
No, it's just to say that we're always looking at ways of how we can use the equipment in I suppose not a better way, or we're looking for more ways that we could use it and make use of the resources that we've got. So we're always interested to hear from people who have a Primus and are using it in different ways, or have feedback for the ways that we're using it, or for those people that may want to collaborate with us or learn more about it. That's absolutely great. So we're always open for any discussions or collaborations.
Sounds good. We can maybe even get a trip to Bournemouth in, which is always a good place to get to.
I'm waiting for you to take me to America again, Andy.
Well, you know what you need to do that, so.
I don't need to.
No, guys, genuinely really appreciate that. Thank you for doing it in such a succinct way. Like I said, we'll put this on there. We'll put your contact details on. So if anyone is interested in speaking with Tom or Shay about how they're using it in future projects, we really love the collaboration of things. So guys, thank you very much for your time and hope to speak to you soon.
No worries. Thanks, Andy.
No worries. Thank you.
Thank you. No, that.
Was that all right?